So renal cell carcinoma is one of the most common and actually one of the most deadly sort of urologic diseases that there is. One of the reasons for that is that actually a high percentage of patients actually, when they present to the office, are diagnosed with metastatic disease at the time that they get their initial diagnosis of RCC. So the socioeconomic and some of the demographic issues that might predict or might be a risk for somebody to have metastatic disease of clear cell RCC at the time of diagnosis actually hasn't really been studied. It's been studied in some other cancers, for example breast cancer, where typically some known risk factors are actually lower socioeconomic status, low income, low education status, and actually African American race. So because of this sort of inequity in the study, we actually looked at the SEER database in order to examine this more fully for clear cell RCC specifically.
To test our hypothesis of looking at socioeconomic factors for risk of metastatic disease at diagnosis for renal cell carcinoma, we used the SEER database, which is a population-based database, and we found from 2004 to 2010 that there was 64,000 patients diagnosed with renal cell carcinoma. Of those patients, 15% had metastatic disease at diagnosis and 85 did not. And when we looked at the comparison between the two groups, we found that patients were older when they were diagnosed. We found that they were unmarried. We found that they were more likely to be living in impoverished countries and less likely to have insurance as well. When we looked at multivariable analysis to look at predictors of socioeconomic status variables and metastatic disease at diagnosis for renal cell carcinoma, we found that the strongest predictors were male gender as well as unmarried status. So really what this tells us is that there's a certain access to care, whether it's inability to get insurance, whether it's inability to make follow-up appointments, but this is a potential healthcare disparity that all clinicians should be aware of.